Urea creams moisturize and gently exfoliate, especially for thick, dry skin. This is good soaking ahead of time and then applying this cream. This is Tom Biernacki, and today I'm going over my top 10 remedies how to exfoliate your thick, dry foot skin, your thick nails, your thick heels, your thick ball of the foot. We're going to help you get that down. We're starting now. On your body, you have 5 layers of skin. And on your foot specifically, the dead layers of skin make up 90% of the volume or more in some people. What happens is that dead layer of skin, blood vessels do not penetrate into that skin. It does not give it nutrition. It does not provide an immune system. That means viruses, bacteria, fungus can live on that skin. This causes eczema. It causes infections. It causes scaliness, thick, powdery skin, lots of problems to the body, toenail fungus, athlete's foot, warts, all kinds of stuff. So it's very important to kind of clean off those layers so that none of this bad stuff happens. I go over guides on my specific skin conditions, but we're starting with exfoliating the skin. The best products and the best home remedies, starting from least practical to most practical. Exfoliation with a foot file. An example is the Pedi Perfect electronic foot file. It does remove dead skin and calluses. It's not something really studied, but it is very effective. I've had a lot of patients use it. You can hurt yourself though. So if you're a diabetic, if you have vascular disease, just be careful not to hurt yourself with your electronic foot file. But tell me if it works. Tell me your favorites. Maybe we'll move it up. Number 9, salt scrubs. For example, a peppermint reviving pumice stone foot scrub. So you combine this by applying salt granules in a paste on your skin, and essentially you then clean it off with a pumice stone with the electronic foot file I mentioned earlier. That's a pretty good product. It's not really studied, but the people who do use it have had some good results. On that note, number 8, sugar scrubs. For example, the Shea Butter Ultra Rich Body Scrub. This provides gentle exfoliation compared to salt scrubs, a little bit more moist. Based on experience and reviews on Amazon, people have pretty good experiences with this thing. Number 7, pumice stone. There's a lot of different pumice stones. It's essentially a rock with holes on it that's safe for your skin. It's not really sharp. It's safer for your skin. You don't want to use this on dry, dead skin. You want to soften your skin up ahead of time. You want to moisturize, so you want to take foot baths. And then you can use it gently on removing rough patches of skin. Be careful if you're a diabetic, if you have vascular disease. I've had so many people rip off their skin, so just be careful. These are all great techniques, but sometimes if you're having wounds, if you're having more health conditions, come see a podiatrist. We do this safely and it's all covered. Number 6, glycolic acid creams. For example, the ultra softening heel and elbow cream. This helps in chemical exfoliation. It's beneficial for rough and dry skin. Some studies support the use of glycolic acid in skincare. The reviews are pretty good. It's a little bit more effective than the other ones. Number 5, urea-based creams. Eucerin, for example, I write prescriptions for these. So 40% type ones that are really effective are prescription-based creams. So sometimes buying these are a great option. There's 40%, there's 20%, there's 12%. Urea creams moisturize and gently exfoliate, especially for thick, dry skin. This is good soaking ahead of time and then applying this cream. Studies and success rates are pretty good. Clinical trials have proven urea cream for both effectiveness in treating dry, rough skin and just dry skin. Number 4, lactic acid solutions. For example, Amlac Daily Moisturizing Body Lotion. Amlac has been studied, and again, this is a prescription cream for higher levels as well, but it can be bought over the counter. A mild lactic acid solution that exfoliates can also improve skin texture. This has been studied and supported by research, but for improving skin texture. Number 3, retinoid creams. For example, these are also used for acne. Primarily, they are used for acne. This is something dermatologists prescribe. Now, this is in more severe conditions, like if you had psoriasis, for example. This promotes effective skin cell turnover and exfoliation. There are numerous studies looking at the effectiveness in skin treatment for retinoid creams. This could be a very effective one. I feel like with the earlier ones, I don't need to prescribe this as much. Number 2, chemical peels. Chemical peels are actually pretty good. Once you get those thicker outer layers off, chemical peels can be very effective. There are some more advanced ones. I link those down below, but they provide deeper exfoliation. You leave them on while you're watching TV. They remove dead skin cells effectively. They are supported by various studies for efficacy in skin rejuvenation. And number one, prescription strength exfoliants. So these are the higher level urea creams, salicylic acids, the 40%, 20%. These are the ones that I usually write for. They're pretty effective. These provide targeted treatment for severe, dry, thick skin. These are the ones that are studied. These are the ones that dermatologists and podiatrists recommend. But here's the really big secret. The really big secret, if you do this stuff, it will fix your thick, dry skin, even if you have horrible problems. Here's the 3 big secret countdown. Number 1, consider prescription cream. I mentioned the topical retinoids. You can use those, the corticosteroid creams. So steroid creams are anti-inflammatory creams that can help quite a bit. And urea creams, like the 40% creams. The reason these are prescription is because sometimes people want these prescriptions, but they don't have the proper conditions. So for example, if you use a steroid on athlete's foot infection, it's gonna make the athlete's foot infection worse, or it's gonna make the bacterial infection worse. Sometimes you need a biopsy, you need a skin scraping, you have to make sure it's the proper condition. And that brings us to number 2, athlete's foot. If you have fungus on that dead, dry skin, it's gonna stay irritated. It could develop blisters. So if you put a steroid on these, it could make things worse. But as you exfoliate your skin, you might be able to soak it. It cleans off that home for that fungus and that bacteria. And then it takes 30 days for that new skin to grow out. But the really big secret is there's 5 layers of skin. And to grow from the bottom to the top, for your body to push out that fungus, that dead skin, that bacteria, it's gonna take 30 days. So no matter what treatment you use, you have to continue for 30 days. Any irritation, bacteria, fungus, like athlete's foot, you wanna keep applying these antifungal creams, these cleansing creams, these urea creams for at least 30 days. And if it's not getting better, if that stuff didn't work, you might need a skin biopsy. It might be some type of irritation. It might be a resistant strain of fungus. That's the big secret. So check out my guide on athlete's foot, my toenail fungus guides, and let me know if that helped.